Hi, I'm Simon Wade. I'm a student of physical therapy. Lucio, do I have your permission to take a video for educational purposes? Mm-hmm. Perfect. All right, Lucio is going to play Cheryl in our Case 3 presentation here. We'll go ahead and get started. So today we're going to do some stretches and some exercises. I'm going to try to help you get that right hip, a little bit more mobility, so able to move, because I know it's a little tight right now. And then we'll do some exercise to help strengthen it, because some of the tests we did determined there's some weak muscles there. So okay, we'll go ahead and do that. First exercise we're going to do, I'll show you first. Make sure that it makes sense to you, and then we'll go ahead and have you do it, okay? So we're going to have you lie on your stomach here, and bend the knee, and what I want you to do is we're going to bring the foot towards the other side. And that's actually what's called external rotation here at the hip, and I'm going to use a band to give it some resistance. Does this make sense? Yeah. Perfect. So we'll have you get started now. All right. Perfect. Let's go ahead and put the TheraBand here. Okay. All right. So, can you go ahead and bring that foot towards the other side? Very good. How's that feel?
Feels good.
Good? Resistance is okay? Yep. Great. Let's see if we can do that 10 times, maybe even 12. If you get tired before we get there, we'll stop, okay? Okay. Good. Very good. Any pain?
Nope. Feels good.
Okay, good. There you go. All right. I can see you starting to shake there, having difficulty getting to the end, so we'll go ahead and stop. Okay. As we continue to do this, we'll work on trying to get more repetitions in and build that muscle strength up, okay? Okay. Okay, great. You can sit on the edge here for me now. Perfect. Next exercise we're going to do is it's going to help with the ability for the leg to come out. It's called hip abduction, fancy word, but we're going to use the TheraBand as well. Mm-hmm. I'm going to have you put that around your right ankle, stand on it with the left side, and then we're going to bring that right leg up, okay? I'm going to have you next to the chair so you can hold the chair. A couple of things here. Make sure you're not leaning, right? We want you to stay upright, and then make sure we're not lifting our, it's called hip hike, yeah. So hips stay square, upright torso, legs out to the side, okay? Perfect. And we're doing, all right. So we put that on there, and then you go ahead and stand on that for me. Very good. And go ahead and show me a repetition. Very good. Let's keep that hip level if we can. Perfect. That's 2. 3. Is that feeling okay? Yeah. Resistance is okay? Good. Good. Any pain? No. Good.
How many you want me to do?
Let's see if we can get up to 10, even 12. But if you feel yourself getting too tired before we get there, that's fine. Okay. Very good. All right. So for those exercises, when you're doing them at home, I'd like you to do those 3 times a week if you can. We'll give ourselves a day off to rest, and then come back. So basically every other day is fine. 10 repetitions. Give yourself a 2 to 3 minute break. And then we'll do that again, so it's 3 sets total, okay? Okay. Can you say that back to me just to make sure you understood it?
So, nice upright posture. If I'm at home, I can do them 2 to 3 times for about 10 reps each.
Mm-hmm. Perfect. And then how many times a week?
2 to 3 times.
Perfect. Great. All right, next I'm going to do a stretch with you. I'll have you lie on your back for me here, with your head at this end, please. Perfect. Okay, so a stretch we're going to do here, I'm actually going to do it for you to help. And we're just going to pull your leg up until we feel a stretch on the outside of the hip. You let me know where you're feeling the stretch so I know that you're feeling it right. Okay. And the goal is going to be 60 seconds total. That being said, it's pretty uncomfortable to hold a stretch, so we're going to break it up into whatever we need. We can do it 15 seconds 4 times, 30 seconds twice, whatever works for you, okay? Okay. Perfect. So on your right leg, we're going to bring this up here. Very good. And I'm going to stabilize and pull across. You feeling this on the outside of your hip here? Very good. 1, 2, 3, 4, 5, 6, 7, 8, 9. How you doing? 10? Good. 12, 13, 14, 15, 16, 17, 18, that good?
Tight, yeah.
Yeah, alright, good. So we'll take a break here, breathe for a second, let some blood move into there, and we'll do that two more times, okay? Alright. Good. Feeling that stretch on the outside of the hip?
Oh yeah.
Very good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Feeling it there, okay? Good. Just take a little break. Shake it out if you need to.
You got me sweating.
Yeah.
That was a tight stretch.
It's a good stretch, I know. This is going to be really good for you because you didn't have full range of motion. We could tell this was tight. We're going to really help open up that hip for you, okay? Let's do this one more time, okay? Good. 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20. Very good. All right. So that's a stretch for the outside of the hip. I'll do that with you each time you come in. We'll work on increasing that range of motion. I'd like to give you an extra stretch. Sorry, you can do it at home as well. To keep working on some mobility there. So I'll have you sit up for me so I can show it to you. So the way we're going to do this is I want you either next to a wall or a chair, something you can hold on to just for balance to make this a little easier. And so if we're stretching the right side, I'm going to have you step over with the left, and then we're going to lean until you feel the stretch on the outside of that right hip, okay?
Okay.
So it might actually even help to have this here on this side. The same thing, we're going to step over and then sink in towards the chair, okay?
Okay.
And then a couple things, just make sure your toes aren't getting too turned either way, just try to point forward, all right?
Okay.
Good.
Stand up.
And then we're going to step over with the left. Very good. And then I want you to just sink your hip towards the chair. And where are you feeling that stretch right now?
On the outside of my hip.
Perfect. Your chest is forward, which is good. Let's try to hold that for, like I said, 60 seconds is the goal. If you can do it for 20 seconds, 3 times, that's perfect. Any pain? Okay, good. The goal with the stretch is just to have the point where there's discomfort, because it's not comfortable to stretch muscle, but we don't want to go so far that it's painful, if that makes sense. Good.
2 rounds of 30, you said?
If you can do 2 rounds of 30, that's perfect, yeah. Good. And the good thing about this is when you take this home and you start doing this at home, you can actually be in charge of your own health, and you really don't have to wait till you see me to start seeing results. You can help yourself get to the next step. Good. All right. So when we do this at home, I want you to do that 2 to 3 times a week for 60 seconds. And if for any reason you're having a hard time keeping weight on that leg, I'm going to show you how to use a cane. That way we can just take some weight off of that.
Okay.
And so I'm going to show you first and I'll have you do it. We're going to hold the cane in our left hand because that's the way it works when we're trying to take weight off the right side. And the goal here is to use our upper body as much as possible to help get up. And the way we do that is we're going to bring our nose over our toes and we're going to push down with our hand, all right? And so we're going to lean forward, push until we come up, and then the cane's going to come down on our left hand. Ideally, the cane would come up to the level of the wrist, but for the sake of this video, we're going to use a golf club, which is going to be a little off. I want you to bring the cane and your right foot together, and then feel like you're pushing down into that cane as you step with your left foot. And that's, the more you press here, the more weight's going to come off of this foot, if that makes sense. And then you repeat and press and step, okay? And when we turn, try to turn to your right side if you can, okay? Or to your left side, because that's a little bit stronger, okay?
Right. Okay.
Perfect.
Stop right here.
Good. All right. Pressing, very good. Now the cane's going to go down on the left hand, good. And let's bring them together. Press, very good. Can you feel yourself pushing into the cane? You take weight off your right foot? Perfect. Okay, you comfortable to do that at home?
I think so.
Okay, great. That's everything we're going to do for today. Thank you so much. Thank you.